291 Aphorism Organon of medicine. Even those organs which have lost their peculiar sense, for example, a tongue and palate that have lost the faculty of tasting, or a nose that has lost the faculty of smelling, communicate the power of the medicine that acts first on them alone, not less perfectly to all the other organs of the body. This section is entirely omitted in the 6th edition, but section 291 in the 6th edition is as follows. Baths of pure water prove themselves partially palliative, partially as homeopathic, serviceable aids in restoring health in acute diseases as well as in convalescence of cured chronic patients, with proper consideration of the conditions of the convalescent and the temperature of the bath, its duration and repetition. But even if well applied, they bring only physically beneficial changes in the sick body. In themselves they are no true medicine. The lukewarm baths at 25 to 27 degrees serve to arouse the slumbering sensitivity of fibre in the apparent dead, frozen, drowned, suffocated, which benumbed the sensation of the nerves. Though only palliative, still they often prove themselves sufficiently active, especially when given in conjunction with coffee and rubbing with the hands. They may give homeopathic aid in cases where the irritability is very unevenly distributed and accumulated too unevenly in some organs, as is the case in certain hysteric spasms and infantile convulsions. In the same way, cold baths 10 to 6 degrees in persons cured medicinally of chronic diseases and with deficiency of vital heat act as a homeopathic aid. By instantaneous and later with repeated immersions, they act as a palliative restorative of the tone of the exhausted fiber. For this purpose, such baths are to be used for more than momentary duration, rather for minutes, and of gradually lower temperature, but they are a palliative, which, since it acts only physically, has no connection with the disadvantage of a reverse action to be feared afterwards, as takes place with dynamic medicinal palliatives.